And welcome back. I'm Mabel, Jong. You're watching live coverage of the World Healthcare Congress coming to you from Washington, D.C. And a very warm welcome back to our viewers who are joining us online. In our studio right now, Dr. Alefiyah Mesiwala, who is Senior Medical Director for Value-Based Care and Innovation for UPMC Health Plan. Welcome.
Hi, how are you?
Well, you haven't actually been at UPMC that long because your last job was with the Obama White House.
Yes, I joined the UPMC Health Plan about 6 months ago. I decided to join UPMC because it really is what I think a leader in, the perfect example of I think how health systems can be successful in what is a journey towards value-based care and the future of healthcare. Just a little bit, UPMC is a $15 billion integrated delivery and finance system, or the second largest integrated system in the country. We're comprised of we have four sides to us. So one is the provider side. It's a very large and growing provider side. We've got 30 hospitals. We admit about 200,000 admissions a year. We've got 5,000 beds. We've got the health plan, which is really, I think, quite unique in that we are the fastest and largest growing provider-led health plan in the country. We've got 3.2 million member lives. And then we've got an innovation venture arm that allows us to really think about innovation and invest in innovation. And then finally, we have an international presence. We're in more than 20 countries, and we either provide care or consult in those countries.
And in your work with value-based care, what strategies are really catching your eye that would be a great example for other health organizations?
Sure. So UPMC Health Plan, we've been in the space of value-based care contracting for the last 10 years. We actually in 2008 had the foresight, as we were kind of a young plan growing, to say, you know what, we need to move into the world of value-based care contracting. And over the 10 years, we've really kind of focused on three areas to really kind of be successful in value-based care contracting. So number one, it starts with the foundation of trust. You really, when you're out there and you're working with providers, they've got to trust you as a health plan. And the one biggest way that we demonstrate that trust is through our commitment to transparency. Our providers know all the data that there is to know: revenue, premiums, costs. And so I think that allows us to kind of walk in the door and have providers really trust us. And that allows us to really then start a conversation about what's our shared vision, what's our goal when it comes to value-based care. The second area that we've very much focused on is incentives. So it's not just about having a value-based, a financial arrangement, a cookie-cutter financial arrangement for all providers. It's really sitting at the table, understanding kind of what are the capabilities of a provider, and then frankly understanding kind of where can a provider make a real impact. And if you can really understand that, you can then tailor a financial arrangement that really empowers the provider to do what they know best, which is to take care of patients and provide high-quality care. So we've really focused on the incentive piece. And the third, I would say, is we have a commitment to transformation. So we're one of the largest academic medical centers in the country. Our researchers are producing a ton of evidence, and lots of new ideas come out of UPMC. And so we've realized that if we're going to transform and lead in kind of what is the future vision of primary care, we've got to support that, and help our providers implement new ideas, think about things differently. And so we've been quite generous when we work with our providers and helping them pilot and do new things. And I think that helps us move towards new models of care.
Well, there's been a lot of discussion about having the right data to propel change. How is UPMC utilizing what they know to help providers give more and better services to their customers?
Sure. So I think from the standpoint of using data, to maybe channel our analytics shop, it's not just about the data, it's really about information. So I think in the last decade, we've aggregated a ton of data, and UPMC has been kind of in the forefront of that. We have a partnership, we have $1 billion partnership with Microsoft. We're, mining data. We've got an integrated delivery. We've got the clinical side. We've got the payer side. I mean, we've got hordes of data. The question really now is, how do you turn that data into actionable clinical information that makes sense for providers and can really kind of drive change? And that's a really tough. It's a really tough problem to tackle. We've got. We're investing in the right technologies. So, and today in the panels, we've heard a lot about natural language processing and artificial intelligence. We're making all the right investments and trying where we can to use some of those technologies. But at the end of the day, you have to be in the room really understanding what providers need and want. And you've got to respond to their questions. And so our approach to data has often been a customized approach. We talk to our providers, understand what they want, and then really kind of sit down with their questions and mine the data and present information that really helps them kind of tackle the question that they're trying to tackle. And as providers get mature, the questions get tougher, and then we learn how to use the data and provide information differently.
What other takeaways were you able to provide during the panel? Sure.
So a couple of takeaways, I think, just from a handful of the value-based care panels that I've attended. I think number one, and maybe let me add a personal commentary here. So I spent the last 7 years in government working on payment models and innovation. Also had some time working kind of with President Obama at the White House and thinking about healthcare reform. And I will say that one of the toughest things in our journey has been, how do we actually get buy-in from the healthcare industry that we need to change? That was the toughest problem that we had to solve. And this transition from a change of administration, I think really challenged the industry. Are we going to change or are we not? And I think what was so exciting coming here and just listening to the conversation that's happening is that I've observed that regardless of what's going to happen in DC and regardless who the leadership is, the industry is on the path to moving forward, to transforming itself and innovating. And this question about whether we should move towards value-based care is really no longer a question. It's really kind of how. And so a lot of the conversation today has been really on the nuts and bolts of value-based care contracting and how do we use data differently. And so it's really exciting to see that shift. It's no longer a question, it's really about the how. To add maybe one more thing, I think that's been quite compelling, is to really see at the forefront of the conversation, a conversation around social determinants of health. 10 years ago, it was tough when we were in government to even have the conversation about social determinants of health because we didn't have a common framework or a vocabulary. And given kind of the changing incentive structures, a move towards value-based care, now we've created an opening to really have a conversation about how we think about investing in our communities, how we think about kind of health more broadly, and that's really exciting, and I think where the future of healthcare really is.
All right, Dr. Mesiwala, thank you so much for your time. Really appreciate it. And I'm Mabel Jong. Thanks for watching. Stay tuned. We have much more to come.